Good morning, everybody. As we know, Risser sign is the parameter traditionally most used to evaluate skeletal maturity, with some difference between US system on the left of the picture and the French modified system on the right of the picture, especially between Risser stage 4 and 3. Another factor claimed to be determinant in evaluating skeletal maturity is Menarche. Also, other important physiologic prognostic parameters are age, height, weight, and BMI. The aim of this study is to describe in Italian patients with AIS the relation between Risser sign and other physiologic parameters. We made a retrospective observational study with a total of 3,553 patients aged between 10 and 21 years. The sample was made of 2,862 females and 691 males. The inclusion criteria were age higher than 10 years, at least one clinical evaluation by our physicians, and also at least one spinal X-rays made by the patients. The two groups of females and males were separately divided into 6 subgroups according to Risser test, in order to analyze data of physiologic parameters such as age, weight, height, BMI, Menarche, and 2 years after Menarche inside each single Risser sign level. We used descriptive statistics, and these are the results about relation between Risser sign and age in females on the left and in males on the right. And we can see the average value on the charts down the slide. Here you can see the age growth between each Risser sign interval in females and males. These are the results about the relation between Risser sign and diet in females and males. And also, you can see here the height growth between each Risser sign interval, also in female and males. Then we analyze the relation between Risser sign and weight in females and males. Here you can instead see on the third column the variation of BMI in each Risser sign interval in females up and in males down. Another important aspect that we analyzed was the percentage of Menarche in each Risser sign level. And we can see that in Risser stage 1, we had 79% of females who had a Menarche. Finally, we analyzed the percentage of 2 years after Menarche patients in each Risser sign level. We must underline the data of 53% of females who had 2 years after Menarche already in Risser stage 3. As we know, the SRS criteria propose Risser tests from 0 to 2 for present studies and 2 years post-Menarche to evaluate skeletal maturity. After this study, we ask ourselves if these parameters are still valid, and also if they are valid in all populations and in various countries. According to our results, we can say that it's important to relate all the parameters examined for timing stop or conservative treatment. And our results also show that the parameter of 2 years after Menarche cannot be considered to determine skeletal maturity. Thank you for your attention.